Hello everyone, my name is Hasan Adiban and I'm going to talk about the patient family centered care, which is one of the topic of interest for me, and I would like to introduce the ideas of improvement of the patient family centered care in healthcare system, especially in Canada. Our objectives today will be to identify the status of patient family centered care in long term care, that we call it LTC, homes in Canada, and to provide recommendations and action plans to see if there are areas of improvement in the status of patient and family centered care. The status of patient and family centered care in Canada has started actually within about less than a decade, and the concept has been developed to have better interaction and information and knowledge and collaboration among the medical team, healthcare services, and the patients and their families. To understand it better, we are going to discuss about the action research that is conducted to understand the concept better. Um, in this concept and in this action research, we are recruiting some patients, families, healthcare providers to conduct some studies and analysis of the data and getting some information to understand the concept better as a sample of the population and the number of the homes. Then we are going to discuss about the current obstacles and how we can implement the new ideas to improve the process. So we are going to propose some suggestions, some solutions, some interventions, and planning and implementation process for improvement in patient-centered care. In addition, we are going to discuss how we achieve the measurement of the effectiveness of the proposed plan and how was the outcome of the long-term care home in relationship with the patient family-centered care. Um, the status assessment of the patient family-centered care was that we have selected the LTC homes, which is the abbreviation for long-term care home, and it was randomly in the province of Ontario, and which is in Canada, and we are going to check the patient and family satisfaction rate, and based on that rate, we decided to go with the lowest rate of patient satisfaction to understand how we can improve the patients and family satisfaction. We have conducted some interviews, surveys, and focus group sessions with the patients, with the families, with the LTC home medical and non-medical staff and leadership team. We have collected the data about the status of the patient and family centered care to understand how far we are from the implementation of the concept, and conducted some analysis of the data to understand the level of satisfaction relationship to patient family centered care, and understand how we can develop an action plan and implement it to improve the patient and family satisfaction rate. Also, we decided to have some measurement at the end of the plan to understand the changes in the patient and family satisfaction by conducting a survey, which is recommended by many researchers and many literature analysis to do so, especially in action research. So the status of the patient and family-centered care um, improvement has some areas of attention. One of them is to know if the facility and employee have the proper understanding and ideas about the PFCC. Then review the leadership status to see how they know, what they do, what are the processes in place to support the concept. Also to have some conversation with the patient and families to know about their understanding about the PFCC concept. In addition to reviewing the environment and see the design and see how the participation and access to information is working in that center to make sure that patients and families get proper information. Also, we conducted a human resource to see resource analysis to see if there are enough staff, if there is any shortage, if there is any impact of the shortage on the patient-centered care, patient-family-centered care concept, the level of education and training of the staff, and how do we implement the patient-family-centered care. The next stage was to identify what are the obstacles, and we understood that there is obstacle of understanding the concept, lack of training, lack of proper process in place to support the concept, a structure that needs to be implemented because there was lack of a structure of involvement of the patient and families, and the physical layout to provide the opportunities for the staff, team, and patient and family to reach that level. The solution for intervention planning and implementation was to develop a training for the concept among the staff, patients, and families, develop a PFCC process that they know their rules, regulations, responsibilities of involvement, who can be involved, how can the involvement happen, develop a structure to have patient family council and membership in the decision-making process in the home care services, and adjustment of the physical layout. After implementation of the process for about 3 months, we conducted a measurement of effectiveness. So we conducted, as we said before, the surveys after the action plan to see the successes, to see the areas of improvement, to compare the satisfaction among the patient and family, to adjust the plan if it is required, and apply the changes. And also, if there needs any adjustment, to implement the new action plan, to develop and implement the new processes with the plan, do, study, act process, which is one of the concept of the process improvement. In conclusion, we have seen a lot of improvement, like 55% in patient family satisfaction. Patient families, medical team, and staff are so happy about the information that was provided during the training, and developed high level of collaboration and communication with the patients and families, and they believe that the result of the patient family satisfaction is going to be mainly on the patient's quality care outcome. This was a quick review of our action plan about patients family care center, and these are the references that you can have access to that we have used to conduct this action research. And I thank you for your attendance to this presentation, and I wish you all the best. Thank you, and have a great time.